you suffer, you know allergy season is picking up, and so many of you might be wondering, how do you actually tell the difference between COVID symptoms and seasonal allergies? Joining us right now to discuss all of this is clinical nurse Alice Benjamin. Nurse Alice, as always, welcome to break it down for us.
Thank you for having me here.
All right, let's talk about some of the similar symptoms between COVID and allergies. What are they?
Yeah, so some of the similar symptoms are those that are from the neck and above. So itchy eyes, runny nose, itchy ears, maybe a sore throat, and some cough. Those are some of the similar symptoms. But now when it comes to having COVID-19, the other symptoms would be something that's more systemic. It's going to go beyond just those that I mentioned from the neck and above. And so those are the things that we want people to look out for. So with COVID-19, you're going to experience other things. For example, acute and sudden stop in your smelling or your taste. You might have fevers, aches, chills, body aches. So things that then go below the neck. And so that's how you're really going to tell the difference between, is this something that's just a seasonal allergy or if this is COVID-19? Just know that COVID-19 is something more systemic and impacts the entire body.
So if you're confused about the symptoms at all, best advice maybe to just get the COVID test?
Well, yes, COVID testing absolutely is very important, especially if you've been in contact with someone who maybe exhibited signs of them. You're unsure of the people that you've been around with. Testing is always a thing to do when you're unsure. And while you're waiting for those test results, also calling very important, we want people to quarantine because, again, while you're in that waiting period, you don't know if you have COVID-19 or not, you could be infectious. So we want to limit that spread by having people to quarantine while they're waiting for their test results.
Nurse Alice, we want to switch gears here a little bit. We've been doing this story all day. We heard about Moderna's vaccine, a specific lot being looked at for allergic reactions in some people in San Diego. The state is now asking providers to put a pause on that particular batch. What more can you tell us about this?
What we know is that there were 6 healthcare workers who all experienced anaphylactic type reactions at the same site on the same day from the same lot of vaccine. So that, Colleen, is very suspicious that there may be something going on with that particular batch. When it comes to an allergic reaction or a severe reaction from the COVID vaccine, what we know or what we anticipate is that perhaps 1 out of every 100,000 people might have some type of reaction. And so to have that amount of healthcare providers in a short amount of time at one location is very suspicious of that. And so most of these reactions happened right away within the first 15 to 30 minutes. They were having difficulty with some of their breathing, some wheezing, some hives. And so those are the signs of allergic reactions that are severe. And if anyone, even beyond just this site, if you go to get your vaccine and you experience any of those things, hives, shortness of breath, you feel like your tongue, your mouth, or your lips are swelling, those could be signs of an allergic reaction. And we want you to call 911 and get help immediately.
All right, Nurse Alice, as always, thank you for that. Chuck.
Thank you.